Coronavirus has been a global phenomenon at this point, and as of this point, we do not have any case in our community, which we are very thankful of at this point. However, we need to make sure that we continue to remain vigilant and continue to monitor the situation. So the way it works, and from the what is the role of health department, I think it's important for everybody to understand. Because it's a public health crisis, this is a global phenomena. The WHO works with the CDC. CDC then works with the different states. In our situation, it will be New York State Department of Health, and which work with the local health departments like Onondaga County Health Department. Why is this crucial? Because it's a channel of communication. Because it's evolving virus, illness, and new information is coming. We are learning every day something new. There are two ways which there are multiple ways we actually, as a health department, we do work. First and foremost is we are responsible for making sure identification of the cases, and also when the identification does happen, you can do surveillance and you can track the cases, and the tracking results in isolation of cases, and also depending on if the people around are the impacted, that will be quarantined. So it's a pretty much nutshell summary of that, what the local health department does. It seems like a one sentence, but it has a lot of work in it. So think of that, those people returning from the countries which has been identified by WHO and by CDC that they could be a high risk category, or where their people are, they have travel alert 2 and 3. You probably know how that works, and the CDC has that in their website. So from the travel alert 3 and 2, and there are travel alert 1. So 2 and 3 we get more concern. Of course, 3 is the one kind of no unnecessary travel. So when people are returning from those countries because they are resident of here, of United States, and they are coming back to their home, CDC does a screening at the airports. There are 11 airports, as you know. And from there, if they are coming, if they've considered them high risk, they are going to monitor them, quarantine for 14 days. And if they are considered medium risk, then they will be allowed to go to their own communities. That's where we come into the picture in terms of returning travelers. So we monitor them, and monitor them like having that called what we call voluntary quarantine. That means people kind of do their own things at home. They don't go to work, and they stay, and they get support from the friends and families or with the local health departments. It is happening throughout the country. It is not unique to us. This is how the system is set, and that information comes from CDC to the state to the local health department. So why this is important, because any returning travelers, if they have fever, they have cough, they have shortness of breath, anything which they're showing symptoms, then they will contact us, or their doctor will contact us, and we connect and we kind of screen them, and then screening leads to further conversation with the state, and then coordinating testing for that individual at a local hospital. That's how the system is set up at this point. So that is a very crucial part of that, because we want to make sure we identify those people who could be who might become symptomatic. Right now they're not symptomatic, and if they do become symptomatic, how we make sure that they go to the right place and get the right testing, and also at the same time protect that healthcare facility and their workforce, because we have to think of everybody, right? It's not only it's the person itself is very important, the person who is at the center of it, but the people who is taking care of this person is very crucial, because if we don't protect the workforce, then everybody will get sick. So there are multiple moving pieces there. The other part, so when I said surveillance, so as you're looking for, we are collecting data, and right now we don't have any local case, but we continue to monitor what is happening at the different states, what is happening at the global level, how many more countries are being impacted. And that is important for us, because we continue to learn from each community when there is community transmission has occurred. Like, for example, if you see in California or Chicago somewhere, or outside of this country, you're talking in Italy, in China, in Japan, in South Korea, then you are looking, and as CDC is learning lesson, it's kind of started to provide continue to provide us guidance about that. So this is very crucial for us to be at the forefront of the surveillance point of view, so we can apply those lessons in our own community. And couple of two other things are very important from the local health department point of view is we have to do the public messaging, which is very important, reassuring people. So at this point, like I'm saying it to you, that we do not have any case here, which we take comfort in. At the same time, we don't need to be complacent about that. We need to be very vigilant about that. And we use some common sense things, what we call non-pharmacological intervention, they call NPI, that's a short abbreviation. It means, because there's no treatment at this point other than supportive treatment, there's no vaccine for that. So how do you prepare yourself? What people can feel that, what can we do to protect ourselves? Use the common sense personal protection, washing hands, protecting, staying home if you're sick, the things which you will do in a flu, right? That's pretty much, and covering your mouth and nose, because the droplets, when you cough and sneeze, things go all over and then puts on the surfaces, puts on a different places. So a lot of those things is we're trying to remind people that you have something in your hand that you can do. It means make sure you follow all the hand hygienes, all these precautionary things which we talk about always in the flu season, and which is still continuing, by the way. And also be informed, stay informed. Look what the health department is talking to you. We have put a lot of information, at least in our health department website page, which connects to CDC and also to the New York State Department of Health. We continue to add, those websites, they change, and then certainly the new updated information continue to be there. So be informed, because if you're informed, then you're going to take steps to protect not only for yourself and at your workplace, but also your home and loved ones. This is very, very crucial. The other part, I think that the biggest concern people have sometimes is that, the places where there's a community transmission. So community transmission, when it happens when person to person has occurred, or from nowhere, like in California, that has been a little concerned that where did this virus came here. In those situations, then that becomes a question, what is the next step in terms of community, what we call the social distancing, and advising schools and colleges having less congregation. But we are talking about those places where there is sustained transmission has occurred, places like Italy, places like Japan, or in China, that you have seen that. So that is very important in containing the transmission, because you want to break that cycle of transmission, right? If you put some barrier in the path of a virus, it means there is no person there to catch that. And if we create multiple layers of that, ultimately it will die off and it will have no way to go. So social distancing work very, very much. And the third part is there called environmental non-pharmacological intervention. In flu season, when people coughing, sneezing, everybody's cleaning up their desk and telephones and all these things. And in a larger scale, when it happens, then you're talking about disinfection and all those kind of things. Those also apply to the places where there have been community outbreaks. So at this point, I think we are fortunate that we do not have any case. However, we are preparing. That's what these conversations all about, is based on the number, how it's evolving from one country to multiple countries to even United States, and we are preparing ourselves. We are looking at our pandemic flu preparedness plan. We are working with all the partners, health systems. You mentioned, you talk to Upstate. We talk to them on a regular basis, to the Upstate, to St. Joe's and VA and Krause and outpatient providers, educational institutions, other county agencies, EMS. So they are all part of, and city and every community which we think can be is part of our county. Certainly we have engaged their leadership and promoting that information and continue to have the dialogue. And at the same time, we have what we call having conversation with the New York State Department of Health, which is certainly continues to provide guidance on a very regular basis to us. I mean, pretty much we have conference call with them twice a week, 3 times a week sometimes, twice a day sometimes conversation if we need it, depending on, because they are there to provide us guidance. and we look for both CDC as well as state. So New York State Department of Health is our, guidance essentially they provide, and they have been fantastic.